Alrighty, so today I'm going to talk about the different reflexes found in a newborn. Little Miss Charlie here is going to help me out. The first one we're going to go over is the Morrow reflex. This reflex can be found in a baby if you pull their hands and their arms up and then suddenly let go. This will create like a falling sensation, and the baby will often flail out their arms and fingers in reaction to that. They'll often cry as well. This is present at birth, and it disappears between 2 to 6 months. If this is absent only on one side, I would definitely check for any upper extremities, any injuries in the upper extremities. First thing that comes to mind would be a clavicle injury, so that's one thing to be mindful about. The next reflex is rooting reflex. If you stroke the cheek of your baby with your hand, they will move to the side where they feel the sensation. So this is a great reflex to have, helpful during nursing because they will move in the direction of the breast or the nipple, wherever baby's going to be feeding from. This is present at birth, and it disappears around 2 months. If the baby is not doing this at birth, I just think that the baby may be a sleepy baby. The next reflex is the sucking reflex. So in order to check this reflex, you do put your finger in baby's mouth and just stroke the roof of the mouth or the tongue, and baby will begin the sucking motion. If this reflex is absent, it will usually indicate that there's like a severe tongue tie or tongue tie, any palate abnormalities, or even a premature infant may not have a strong sucking reflex. The gallant reflex, you would just lay your baby in a kind of curled, semi-curled position on their side, and with your hand, stroke one side of their back. The baby should move towards the side that had the sensation. So if you stroke the right side, baby should move towards the stimulating side. Baby should move towards the right side. Vice versa. If you stroke the left side, baby should move towards the left side. This will be present at birth and usually disappears within 9 months. If this is absent, it may indicate neurological disorders, brain damage. The next reflex is the palmar grasp. So this one, little baby will just grab onto your finger if you put it within their hand. And this reflex is present at birth. And if it's not present, I would look into sensory dysfunctions, or any upper extremity injuries could also cause this to be lacking. The next reflex is a plantar grasp, also known as a grasp reflex. So you could test this reflex by putting your finger under their toes, and they will grasp onto your finger with their toes. This is present at birth, and usually disappears within 2 to 3 months. It's possible that it may indicate hip or nerve problems, or even spinal injuries. The crawling reflex is the next reflex that we're going to go over. You could just place the baby into a crawling position, and this reflex, the baby will push up and try to crawl. This reflex is present at birth and usually disappears around 6 weeks, but then it will reappear because they eventually learn how to crawl. I would also check for upper extremity injuries if this is a difficult reflex for a baby. The next reflex is my favorite reflex, the stepping reflex. It's also known as walking or dancing reflex. In order to test this reflex, you just place baby on a flat surface, and their feet will they will begin to take steps, one foot, and then the next in front of the other. This is a really cute reflex because it looks like they're walking. I love this one, and it usually disappears within 5 or 6 months, but also will reappear when they begin to walk. Babinski reflex. So this reflex, you stroke the baby's foot and their toes will bend back and flare and fan out. This reflex is present at birth and usually disappears around 2 years old. The deep tendon reflex is a reflex that you use a little tool, use a hammer for it, and this reflex is you just tap in between the tendon or onto the tendon and baby will react, and that's how you could test the deep tendon reflex. It is present at birth and this occurs throughout one's life. If the deep tendon reflex is absent, it may indicate a neurological disorder or a motor disorder. The next reflex is the protective reflex, and this reflex, also known as sneezing or coughing or blinking. So, these reflexes obviously have individual purposes. So, if baby is sneezing, it's clearing out anything that may be in their nose, in their sinuses. Coughing will clear out airways, and blinking will help keep their eyes protected. It is present at birth, and this is a reflex that occurs throughout one's life. The last reflex I'm going to review is the magnet reflex. And this reflex, you can lay baby down and you apply pressure to the soles of their feet, and the baby should push back up against you. This is present at birth, and it disappears within 4 to 8 weeks. If this reflex is absent, I would look into a spinal injury or hip or nerve problems. That's all the reflexes that we're going to go over today. Thank you, and I will see you on the next video.